Hello guys, welcome to Plat Medic, and today we're gonna be talking about prostate cancer. Yeah, I know. We said prostate, we said cancer. The first thing that comes to your mind is, oh, there must be some kind of cancer or tumor in the prostate, right? Great. If you were thinking that way, you're right. So with prostate cancer, there's usually an enlarged prostate, and this is probably as a result of the tumor. So if you compare it with the normal prostate, you can see that there's quite a difference in the outflow of the urine. In the normal prostate, the urine kind of flows normally, but in a prostate cancer patient, there is restricted flow of urine. And these prostate cancer patients usually present with certain lower urinary tract symptoms. But mind you, these symptoms are not only specific for prostate cancer. That means these symptoms can be found in other urinary tract diseases. So if you see these symptoms in your patient, you don't just say, okay, I know these symptoms, you got prostate cancer. No. You see these symptoms, you just add prostate cancer to your differential diagnosis. So what are some of these symptoms? Based on the pathology, you're going to have patients presenting with hesitancy, urgency, poor or intermittent straining, prolonged micturition, feeling of incomplete bladder, and dribbling. So you can see our dude down here kind of seems to be in so much trouble, probably in public, feeling like, oh my goodness, I might be embarrassing myself today if I don't find a place to ease myself. And that is some of the symptoms you see in a prostate cancer patient. But mind you, they are not specific for prostate cancer only. So who is at risk for prostate cancer? Of course, people with increasing age, and I'll talk about that in just a moment. And we said prostate cancer. Hello, you gotta know that it's in males. Come on, you can say prostate cancer in a female. Come on, what are you talking about? Prostate cancer, males. First degree relatives with prostate cancer as well. Now, when we talk about the investigation, you gotta remind yourself that we said that in the signs and symptoms, it is not only specific. The symptoms are not only specific for prostate cancer. Other urinary tract symptoms are there as well. So there is a need for further investigation. And our initial investigation, most of the time, is direct. It's the digital rectal examination. So we do the digital rectal exam, and what we do here is we put our finger in the rectum and we try to feel the prostate. So we're gonna have a hard, irregular, and nodular prostate, and that could also help you draw your attention closer to making prostate cancer as the main diagnosis. And then we can add a PSA test, even though a PSA test is most of the time used as a follow-up test, but the PSA, which is prostate specific antigen test, is added when we do the digital rectal exam. And as you can see over here, this patient quite has a positive result. So based on the risk factors, we said increasing ages. So people with ages between 40 to 49 years of age with a PSA test of above or equal to 2 nanograms per milliliters can be also diagnosed as having it. And if we look at 50 to 59 years, then we're looking at results of 3 and above. 70 years and above, we're looking at results of 5 and above nanograms per ml. But then, one thing we need to know is that prostate biopsy is usually our definitive diagnostic investigation. And what we do is we take the prostate biopsy tool, which is the biopsy gun with its ultrasound probe with a needle at the top. So the ultrasound is going to serve as a guidance to guide us towards our suspected area. And then the needle at the top is going to help us take a sample for the biopsy. And we are going to test for prostate cancer. Now, when it comes to management, mostly we give what we call the leoprolide. I don't know how you're going to pronounce it, but I call it the leoprolide. And it depends on how you're going to administer this leoprolide. How? If leoprolide is given in a pulsatile fashion, it acts as an agonist. But if it is given in a continuous fashion, it acts as an antagonist. And therefore, leuprolide given in a prostate cancer patient is given in a continuous fashion because we need it to act as an antagonist. And therefore, what is the function of leuprolide? Well, it happens to be a gonadotropic releasing hormone. And if we give it in a continuous fashion, that means it is going to antagonize the anterior pituitary gland releasing of follicle stimulating hormone and luteinizing hormone. And as you can see over here, these hormones are antagonized, they are blocked from being released, and therefore there is blockade of testosterone release, and therefore you kind of control your prostate cancer and manages it with leuprolide. So that's basically it for prostate cancer for our plan. Thank you.